Hi, I'm Dr. Sigmund, and this is how we do it.
Hello! Today we're going to talk about a test called Point of Care Ultrasound Optic Nerve Sheath Diameter, or PoCUS ONSD. PoCUS ONSD is a non-invasive test that uses ultrasound waves to check the size of the optic nerve sheath, a structure that surrounds the optic nerve that connects to the back of your eye. Here's a step-by-step tutorial on how to perform the test. You'll use a linear probe with an ocular or superficial preset as shown here on the left. You can place a protective covering over your patient's eye and use gel when you're doing the ultrasound. The test typically takes about 5 to 10 minutes and you'll scan each eye. You're going to measure the optic nerve sheath diameter in the transverse plane 3 millimeters behind the eye as shown here. Most people will have optic nerve sheath diameters less than 5 millimeters. When patients have certain brain injuries from strokes, trauma, and infection, they can develop high brain pressures, which is an emergency and needs to be treated. High brain pressures cause secondary injury and lead to increased morbidity and mortality. For patients with high suspected brain pressures, an external ventricular drain, or an EVD, is really the gold standard to use to monitor and treat high brain pressures. But some patients can't get this device because of contraindications like bleeding risk or being on a blood thinner or other contraindications. The optic nerve sheath is really just an extension of the dura and the subarachnoid space that surrounds the brain. So when high brain pressures happen, the sheath and the CSF beneath the sheath can expand, giving us clues to high brain pressure, and this is a non-invasive way to assess for high brain pressures when you cannot get invasive testing. So remember, while most healthy people will have an optic nerve sheath diameter of less than 5 millimeters, patients with increased intracranial pressure or high brain pressures will have swelling of the optic nerve sheath, and the optic nerve sheath diameter will increase in size to greater than 5 to 6 millimeters. If you are a patient getting this test, during the test, you'll be lying flat down on a hospital bed. You may feel a slight pressure on your eyelid as the healthcare professional applies the gel and moves the ultrasound device around your eye. The test is painless and non-invasive, and you will not feel any discomfort or pain. After the test, the healthcare professional will review the images and discuss the results with you. If any issues are detected, they will explain the next steps and the necessary treatments. That's it. That's PoCUS ONSD. It's a quick and easy test that can provide you with valuable information about your patient. Remember to use this test next time you can't do invasive monitoring on a patient and you're worried that they might have high intracranial pressures.